Devon. This is my medicine administration video. Okay, so before I go in to see the patient, I'm going to review the patient's chart along with the MAR, which is the medicine administration record of the medicines that's ordered for the patient to take. We're gonna review the MAR and compare it to the order, making sure that it matches, making sure the patient name is the same. We have Miss Kathy Evans, 180. Now let's see if our MAR has the same. MAR has the same patient, Kathy Evans, 180. Same MRN. Medications. For night shift is what I work, so we're going to be doing medications on night shift. We have a multivitamin, 1 tablet by mouth with breakfast at 0600 hours. Let's review here. Okay. Then we have amlodipine at 0600 hours, 5 milligrams IM, twice a day. Let's see. Okay. And then we have regular insulin, 3 units, SQ or sub Q with breakfast and lunch. And I have it for 0600 hours. All right, it is verified here. I will also verify it against the medicine as I pull the medicine and prepare the medicine. So I would verify the insulin, which is going to be this little pin right here. I would verify that, well, this is going to be the needle, but the actual little jar of insulin, I would have to verify that it is the regular insulin that I'm pulling for the patient, or whatever kind is listed in the order. And then the amlodipine, that one I would also have to verify as I'm pulling the medicine and putting it into this syringe, because this is going to be a little bigger syringe, and this is what's going to be used for the IM injection. All right, and then the multivitamin, we just have to verify that it is the correct multivitamin for the patient. Okay, and all this is done before going into the patient's room, is preparing. So now we're going into the patient's room. We're verifying the patient, both by asking name and date of birth and by checking the armband, and then checking that against what we have on our MAR and our orders, or our patient's chart, I should say. After all is verified, we'll let the patient know, I have these medications for you. I have a multivitamin that the doctor wants you to take by mouth. I have amlodipine, that's going to be an IM injection, and I have 3 units of insulin, also going to be an injection. And ask the patient if they're okay with that, if it's okay to proceed or administer the medication. Once the patient agrees, then we give them a choice as to which medication they would like to take first. In this case, Miss Kathy is going to take her multivitamin by mouth. So we're going to have a cup of water with us. We're going to hand it to the patient. We're going to give her her medication, her multivitamin, and then we're going to stand by the bedside, of course, until she takes the vitamin. And then also we would then move to the injections. So Miss Kathy wants to do her insulin next. So when administering insulin, we may have to roll the bottle a little bit to mix it up. When using an insulin syringe before placing it into the valve to draw back the insulin. We have to draw back some air up to the point of the 3 units, so, or whatever the units are. So we're drawing back the insulin to 3 units, or the air to 3 units. Then we insert it into the vial of insulin, and then we push the air in to the insulin, turn it over, and then draw back. We don't want any air bubbles, so if we have to readjust it a couple times until we get 3 units with 0 air. Then at that point, it's sub-Q. So we would pick, that just means that it'll be in a fat tissue or fatty area. So we would pick just an area on the stomach, and maybe even ask the patient if, oh, this is Miss Kathy. Maybe even ask the patient where's her last injection, so that we can rotate the site. So we're gonna assume her last injection was on this side. So we're gonna inject on this side our 3 units of insulin that we drew up in our syringe. All right, so we're going to inject the insulin, and we just let it sit for a minute and take it out and put our Band-Aid. And before that, we really should clean the site with alcohol. Then inject the insulin, let it sit, and then pull it out. Oh, my medical records went away. All right, so then we put our Band-Aid, and the insulin has been administered. On the opposite side, or actually, we would ask the patient to turn to her side for the next injection, because it's IM injection, which means it's going to be intramuscular. So we would turn her to the side and use an area that is muscular. So we would use like the upper part of the thigh area. We would clean the site with some alcohol. We already have our medicine prepared and drawn up. So we've drawn up 5 milligrams in this syringe. And then we would inject the site, but we would draw back the needle before injecting the medicine to see if there is any blood return, just to make sure that we're actually in the muscle and we didn't hit a vessel or something. And if it's all clear, then we inject the medicine and hold it for a minute, and then pull out. Put your gauze or your cotton ball, and then put your Band-Aid. After everything is administered, we would dispose of needles in a sharps container. Or actually, before we do that, with the insulin needle and the IM needle, we would scoop the cap back onto, the needle. We use the scoop method. And then we would dispose of it in the sharps container. So same for this one, we would scoop the cap back on, and then place it into or secure it, and then place it into the sharps container. And that is how we administer medication. We do have to reassess the patient ask them if they're feeling, or if they're in any pain or discomfort or anything like that. Make sure they're comfortable. Put the bed down if we raised it. Lock the bed. Give the patient their call light and let it, And then also one more thing with the multivitamin and the insulin is supposed to be given with breakfast and lunch. So her medicine was given at 6 a.m. Or 0600 hours, which means we would have to order her breakfast for that time also. And that's it.